Well, I had, and I go into this in my book again, both experiences. I had one ICU that was phenomenal. The one I talked about, they gave me the spa day. When I got strong enough to leave that ICU, I went to an LTAC where I got the worst care that I could possibly imagine. So I've seen both sides of the spectrum. The next place, the LTAC, the long-term acute care, I thought that's where my life was going to end many times. Many times I would push the call button, no response. My machine pole tower thing, whatever it's called, beeping, no one would come. I got to the point that I finally took off all the tubes off my fingers and the chest sensors, seeing if they would come if all the alarms are blaring. No one would come. They didn't know how to tube feed me. My husband had to teach them how to use my tube. They weren't sure how to open the tube to properly put the carton of whatever you want to call it, food. It's not really food, it's chemicals, but my husband was having to teach them how to feed me. And that to me, talk about anxiety again. Oh my gosh, am I going to die? My husband was so terrified to leave me at that place, but they would kick out family after a certain time. And he was terrified. My mom was terrified, thinking, oh gosh, if we leave her here, who's going to advocate for her?
Right.
That was the time.
Oh my gosh, that would be so scary. Hello, everyone, and welcome to the Medical Trauma Support Podcast. And I am super excited because I have Vanessa Abraham back. This is our second podcast episode that we're doing together because there was so much we talked about in the first podcast that we didn't even get to the second topic that is so important. But before we go there, I want to introduce Vanessa. She is a speech pathologist. She's the author of Speechless, and she is a medical trauma survivor. She had an experience in the ICU that she writes about in her book. And Vanessa is also a mother. Hi, Vanessa. Thank you for being here.
Oh, thank you. Thank you for having me back. I can't wait to dive into more medical trauma conversations.
Me too. And one of the big reasons that I highlighted that Vanessa is a mother is because that is what we're going to talk about today. Where Vanessa is going to share what the experience of going through her own medical trauma while mothering was for her and her family. And before we jump in, Vanessa, I wanted to see if there's anything else that you wanted to share with the listeners about your background or anything like that.
So yeah, sure. I can definitely kind of give everybody a background of what I do and why I am the way I am now. So like you said, I am a speech pathologist. I was in the ICU 6 years ago. As a speech pathologist, I work heavily with students that are nonverbal or have severe communication challenges. And I was a very thriving young mom, just working full time, very busy. And within a week's time, I wound up in the ICU, unable to move my upper body, unable to communicate because I was intubated and further on, given a tracheostomy. I was using everything to communicate from eye gaze to text to speech to finally using a passing mirror valve on a tracheostomy to vocalize. So as a speech pathologist, I've kind of been through the whole gamut of speech pathology or speech therapy, from everything from communication to even swallowing, because my swallowing muscles are paralyzed. So I have a lot of experience of what it's like now being the patient in the bed, as opposed to the provider providing the therapy services. And yeah, today I would love to dive in a little bit more into the concept or the topic of post-intensive care syndrome, family, PICS family, PICS family, and how that affects the family members, how that affects the children that are in our lives, watching their parents go through a medical tragedy, or just the child themselves, what they're going through when they are in the ICU experiencing medical tragedies.
Right. And I also really want to highlight the fact that you were already doing this work as a speech pathologist when you then had the experience of being in the hospital unexpectedly and losing your ability to speak and swallow. And I just think that there is such a depth adept to the work that you can do with other people because you've been on both sides.
Absolutely. I now understand medical trauma, uh, not only medical trauma, but just trauma in general, and the depression, anxiety that goes along with that. I understand, and I can, and not that I understand, it's just that I can see more because I wasn't the caregiver, but I can see more of the stress, the anxiety, the depression that the family goes through in terms of being caregivers. Now, their lives are also transformed. I think I talked a little bit in the previous podcast of the loss of self, the loss of identity that I went through. Caregivers, as family members, they go through a loss of identity as well, and that needs to be
Mm-hmm.
acknowledged.
Yes.
My husband, for example, went from working full time just like me to all of a sudden overnight being a caregiver. I went
Mm-hmm.
overnight to being the patient in the bed, unable to communicate. I went through a whole different experience.
Mm-hmm.
The spouse, the family goes through something entirely different. They're both different, but they both need equal attention.
Right, right. Yeah, I think that's so important. Like, step one is to educate the system, change the system so that the patient, the person who has had the experience in their body to get mental health support as just part of everything. Like, that's such a crucial piece. But then also the family needs to get that same mental health support and that community support because it's so impactful. And what I was thinking about as we dive into this and the experience that your child had and your experience of being the mother as your child's having the experience is starting out with, I kind of think of it in two separate parts, right? There's the part where you're in the hospital and your child's experience of that. My mom is no longer at the house. She's no longer taking care of me. Now she's in the hospital. And maybe not fully understanding what that means. But and then there is the second piece, and that's when you come home and life is different. And so I'm curious if you'd be okay if we started out with the in hospital experience.
Absolutely. I'd love to talk about that. The in hospital experience for me, being the mother, at that time, my daughter was 3. She was very young. My anxiety in the hospital setting, I would say majority of the anxiety that I experienced in the hospital setting was because I was worried about her. I was worried about her future. I knew my situation as a speech pathologist, laying in the bed, unable to move, unable to talk, unable to eat food. I knew I was in a very, very bad situation health wise. All I could think of in that ICU room was, if I do get out of this ICU room, what is my quality of life going to look like? And what is that quality of life going to look like in terms of being the mother that I always envisioned myself, the goal that I always wanted to be for my daughter? I wanted
Right.
to be the mom that could go out there and run and ride a bike with her child. I wanted to be the one that was going to, go to birthday parties and play dates. And I had this vision for myself when I was pregnant with her of this is what our life would look like together. I would be doing this, that, and the other, and we'd be traveling. And then all of a sudden in the ICU bed, all I could think about was, am I going to be the mom? If I do make it out of ICU, am I going to be the mom that's nonverbal, that's going to be using text to speech on my phone? Am I going to be the mom that's going to be tube fed? Am I going to ever walk again or move again, or I'll be in a wheelchair, or will I be in my bedridden for the rest of my life?
Yeah.
So the anxiety in the hospital setting for me was profound. I was obviously worried about my own health, but I was just so deeply worried about her. I was very fortunate. She was living with my parents at that time. So
Mm-hmm.
I did have a sense of a little bit of relief knowing that she was in a very loving home. If there was anyone else, there was no one else on the planet that I would rather have my child be with during that critical period of my life than my parents. But I still worried, is she, my head, I'm laying there thinking, is she thinking about me? Is she worried about me? Is she wondering where all of a sudden mom was here every day in my life, holding me, giving me comfort, feeding me, you name it. Then all of a sudden mom's gone.
Yeah.
And I
I
would worry, go ahead.
Well, I was just going to say, I think for anybody listening to understand, that is a really important layer that so many people are experiencing when they're in the hospital, especially not even just especially, but I was thinking when it's unexpected, right? You weren't expecting these things to happen. Um, I really want everyone to pay attention to that, because that's one of the many layers of what is going on with people, with the experiences when we're we're having something like being in the ICU, or even a surgery that where something goes differently than expected. There's this layer for parents of, how is this going to impact my family? Just to understand, it's not this like cut and dry experience. There are so many factors and so many layers, and there's so much worry, and there's a lot of grief. Like what you described, grief came up so strongly.
Mm-hmm. Grieving process was huge, to the point that my doctor, and I talk about this in my book Speechless, my doctor and my husband posted pictures all over the wall in front of my bed of her and I and my family, just to
Mm-hmm.
give me a little bit of hope and
Mm-hmm.
give me a visual of what I was working for, to keep me optimistic and keep me fighting,
Mm-hmm.
because that grief was it was so profound that I was heavily medicated with anti-anxiety medication just to bring me down. I was so worried about her future, my future, even to the point when you were talking a minute ago, it reminded me, a little bit of a memory came up. I remember laying in the ICU bed, so worried about her future. And I remember thinking, oh, I'm so glad I just paid my life insurance bill last month. Because if I die, she'll at least have a little bit of money. My husband will have a little bit of money to help pay for daycare, help cover expenses if I don't make it out of here.
Yeah.
Those thoughts were so real. Like, what if I laid in bed too, thinking, I'm getting a little teary eyed thinking about this, but of maybe this is when I was able to vocalize again and talk on some level. I thought about making a video with my phone of myself,
Mm.
so she knew what her mom was fighting for in that bed. I never did, but I thought about it many times, that I thought, how do I want her to remember me? Do I do I record this video of my last words to her, and how much I loved her and how much I was fighting for her?
Yeah. I think any parent listening to this can like feel how painful that would be, and how much grief would be in that.
Mm-hmm.
Mm.
Real. It's and nothing prepares you for it. You're just thrown into it, and you're just trying to survive with all of this fear being thrown at you, grief, worry. It's it's just insurmountable, and I wish there was something in the ICU setting, in that critical state, that people could do for loved ones to reassure them. I just don't know if there is anything. At that time, she was just so young that I don't know if she really remembers. Well, there's a little bit she does remember. There was one day that she was able to come into the ICU room. My medical team was phenomenal. They really decorated the room, made it look really child friendly for her, so it wasn't so intimidating. But unfortunately, I was kind of scary looking. I was covered in tubes. I had a tracheostomy tube out of my throat. I had an NG tube, which is the tube in my nose for feeding. Um, so, for a 3-year-old, that's kind of creepy and scary looking. And we tried as much as they could to cover up all the tubes on me when she did come
Hmm.
to see me. But that was another thing that was very scary for me, that I wanted to see her so badly, but I didn't want to scare her.
Right.
And that
And
weighed heavily.
what was it like when she saw you?
When she walked in the room, and I made it a point to get out of the bed and into a chair, so I wasn't like just laying there in a bed, but the staff very carefully moved me from the bed to the chair. But when she did come in, she was kind of glued to my husband. My husband was holding on to her, and he was kind of like, trying to turn his body so she could see me. and she just kept kind of like turning away. And then, of course, for me, the patient, I wanted to cry, but yet I didn't want to scare her. So I tried to stuff it, tried to stuff that feeling, tried to be the strong one, even though I was cracking. I was like in bad shape, but I didn't want to scare her. So I just kind of, that saying, you fake it till you make it. I kept trying to smile through it and knowing that just by her body language of not just, usually little baby, they see mom and they want to immediately go to mom. They put their arms
Yeah.
out to you and they want to go to mom. That wasn't her natural instinct.
Mm.
Whereas a couple weeks before that, she sees mom, mama, you know what I mean? Little babies,
Yeah.
they're little toddlers, they gravitate to mom all the time. And
Yeah.
she didn't do that. And that crushed me. But I also knew why. I thought,
Yeah.
she hasn't seen mom in 2 or 3 weeks. Now she sees mom, and mom looks a little bit different. We're in a different environment. So she kind of stuck on to dad. And then the medical team too did bring in some toys for her. So she kind of sat there on the floor and played with some toys, which was really nice. It was a good distraction for all of us. She was down there doing that. But I do have some pictures. I think there's one in my book too of my husband kind of holding her next to me so I can kind of, I couldn't move very well, but I could at least kind of turn around and like, rub her back or something like that. But I didn't really hold on to her because again, I had these tubes all over me and it wasn't necessarily safe, but it was a very anxiety provoking moment, period.
Yeah. And heartbreaking. I mean, it just sounds like heartbreaking that, to have your child not reach for you. And really, what you needed more than anything was for her to just
Yep.
hug you. That's what you needed, was just, you need to be loved on too. So that, oh my gosh. Can we like take a second to like maybe do straw breath or something together for both of us and for anyone listening who may be feeling big feelings right now? And so if you've listened before, you may be familiar with straw breath, but I'll describe it before we do it. And a straw breath is simply you're breathing in for a count of 4 in your nose, and you're breathing out of your mouth with your lips pursed as though you're drinking from a straw for a count of at least 6 to 8. So we'll start out now by breathing in for a count of 4. Let's do one more for anyone listening or watching. You may want to just take a few seconds to feel your feet on the floor or your seat in your chair. And we'll do another straw breath in for 4. And then out for 6 to 8. And if that practice resonated with anyone, that's something that you can just take with you. And when you start to feel a little bit overwhelmed or scared or angry, doing a few straw breaths can really help bring you into more of a sympathetic place, a parasympathetic place in your nervous system.
I wish
Yeah.
I had some of those strategies in ICU. Since then, obviously it's been 6 years, and I've learned so many different strategies to get myself into that more relaxed state. But the things that I wish I knew then that I know now.
That's why we're here. That is so, that's why both Vanessa and I are here, is because we've both been through hard, traumatizing situations in medical settings. And we both wish that we had had somebody to help guide us and let us know we're going to be okay and that our kids are going to be okay, and give us some of these practices. But we're doing it now. We're helping other people with it. And then the thing that really stood out to me a few times as you were describing your experience was your medical team and the extra things that they did for you. You shared that your doctor, along with your husband, put up the pictures of you with your daughter and with your family. And then, your medical team covered up the tubes as much as they could and brought in toys and decorated your room. I would love it if you would talk a little bit more about that.
Yeah. Oh, I love talking about this because amidst the tragedy and the grief, the depression, the anxiety, all of that that was happening in the ICU, there were so many blessings. Again, I talk about those in depth in my book because I was blessed. Even though it was a terribly scary time, I had nurses that were giving me spa days. Um, they really did what they could given the time that they had with me, during an 8-10 hour shift to really address my anxiety. They knew I was a mom. They knew I was also a speech pathologist. So they knew that, whoa, her anxiety, she's got to be scared to death right now. She knows that she has a severe swallowing impairment. She knows what NPO means that you can't eat anything. She knows that, look, she can't lift her arm and what that means. She knows. So they did everything they humanly could to relieve some of my anxiety. They, like I said, they decorated my room, but whenever there was a video of my daughter, it came through. They would share with me pictures of my daughter, ask me questions about her, and I couldn't obviously verbalize answers, but I did have like an alphabet board, a piece of paper that when my fingers were able to move again, I was able to at least type and answer questions and tell them about my daughter and say how old is she, and I could point at the age number and have conversations with them. Like I said, they did a spa day for me one day because, as a woman, I didn't shower. I didn't, sponge bath, but and as women, we like to feel clean. We like to have our hair done. We like to put makeup on. We like to feel pretty. Well, I didn't shave my legs for 3 weeks a month. My hair wasn't washed. It was in this big, messy bun on the top of my head for weeks. I didn't know what it looked like. But they came in one day and figured out a way to shave my legs in bed. They
Oh,
got real creative and figured out ways to do that. They painted my toenails one day. They brought in a big, huge trash can and somehow managed to tip my chair over, wash my hair, and brush it.
oh,
Those little things went so far to making me feel human again. And it was like a little bit of a mental distraction because it was something different instead of trying to get up out of bed and trying to vocalize again and trying to swallow water again and doing all those things. Those are scary, they're traumatic events, they're anxiety provoking. So having a little spa day was just a way to like bring down that nervous system, which was just beautiful. But sometimes too, they would come in with lavender. That was another thing that was really nice, something very natural. Rub it on my feet, kind of rub my feet a little bit, put some socks on there. Just some really natural things to calm me down. And I was very blessed with a medical team that really took my needs into consideration.
that's so beautiful because it's like they were humans recognizing your humanness, and just what a beautiful way to care for someone and like love on you when you really needed it. And I just think about the like almost like even the intimacy of having your hair brushed. And that's just such beautiful caretaking. Thank you for sharing that.
Yeah, and it's a beautiful story too because I still keep in contact with a majority of them, which is really cool. A lot of them helped me write the book because I don't remember a lot of it, but they remember me. Just
Yeah.
recently, I reached out to a respiratory therapist. As I said, it's been 6 years, and this respiratory therapist says, "Yeah, I remember you. Totally remember you." And that just warmed my heart beyond belief to think that, wow, you remember caring for me. You see how many patients in a year and in and out of the ICU. It's a very traumatic working environment for the professionals in that environment. And to think that they remember me, wow.
It makes me wonder that they might be working at a place that takes good care of them. You know, I think it can be felt, right? When a hospital or practice takes care of the people working in it, they have more capacity, like emotional and time capacity, to actually give that extra bit of care that made such a difference for you.
Sarah, you bring up such a good point because I was just recently talking with one of my nurses and doctor about the trauma that they go through as medical professionals and how they need to be taking care of their mental health to be able to give to their patients, and how oftentimes that's overlooked. And that's really scary. You know, they may have a patient pass away that day in the ICU, a tragic event happens, whatever it may be. And then within minutes, they have to go and do some type of life saving event or something to another patient in the room next door. And then 20 minutes later, they may have something else going on down the hall.
Mm-hmm.
So their nervous system is always in fight or flight, and they need that
Mm-hmm.
time. Just like us patients, we need that time to get into more of a parasympathetic state. They need that too, and it's important.
Yes. Yes. I agree 100%. I mean, what we expect from medical professionals is like superhuman. It's really not realistic for humans. Some of the things that we expect of these people, and they really need opportunities, and I think opportunities while they're at work, because again, it's not fair to put the burden on somebody of, oh, well, now you've just done this long shift. You very likely have people at home you have to take care of. Oh, and the burden's on you to go and get a massage or to go to a yoga class or go to a sound healing. And so I do really feel like if we want to improve the experience for patients, we really have to take care of the people working in the hospitals and the other medical settings. That is a crucial piece to improving and, well, really reducing the rates of medical trauma that people experience.
Mhm. Think about this. I had this thought come into my head the other day. Police officers, if they are on duty and they witness a homicide or their partner is murdered while on duty, these traumatic events that they witness, they are given time off. They are given therapy before they're allowed to come back to work. There's so many hours, there's so many days they need off just to process that trauma, which is great. All doctors in the ICU or any medical setting, they may have a patient die, they may have a patient pass away. They're back to work the next day.
And what I want to point out about that is not only do they have their own feelings about that person passing away, and I know there must be many layers. I'm not a doctor or nurse or medical, you know, provider, but you have your own feelings, but you then have the feelings of the family because you're talking to the family about it. So it's devastating to you for one of your patients to die. You then are being with other people who are absolutely devastated. It is a lot. That is so much to put on a single person, and for some people that's happening daily or at least weekly, and they need care. They need extra care, just like in your really hard unexpected experience. Those little moments of having them figure out how to wash your hair and to brush your hair and to paint your toenails, like those little things showed that you were cared for and that you mattered. And so I do really think the system needs to put more effort into showing these people who are doing this work of saving lives and caring for people and helping them heal that they matter and their work matters and it's important. And I know this, it's really interesting because this topic can almost be controversial because there are people who've had really hard medical experiences and they haven't felt the care that you felt. And so maybe they may be angry hearing us talking about this. And that's okay. And if you're angry, that's all right. You feel angry. You have every right to feel angry. You also have straw breath if you want to do that when you're feeling really angry. But I do think it's really important because if every one of us were able to be cared for by a medical provider that is also being cared for by their system, it's going to be a different experience for the patient. So,
Well, I had, and I go into this in my book again, both experiences. I had one ICU that was phenomenal. The one I talked about, they gave me the spa day. When I got strong enough to leave that ICU, I went to an LTAC where I got the worst care that I could possibly imagine. So I've seen both sides of the spectrum. The next place, the LTAC, the long term acute care, I thought that's where my life was going to end many times.
Mm.
Many times I would call for, push the call button, no response. My machine pole tower thing, whatever it's called, beeping, no one would come. I got to the point that I finally took off all the tubes out of my fingers and the chest sensors, seeing if they would come if all the alarms are blaring. No one would come. They didn't know how to tube feed me. My husband had to teach them how to use my tube. Um, they weren't sure how to open the tube to properly put the carton of whatever you want to call it, food. It's not really food. It's chemicals, but my husband was having to teach them how to feed me. And that
Mm.
to me, talk about anxiety again. Oh my
Right.
gosh, am I going to die? The thoughts are going through my head of, am I going to die because they don't know how to feed me? Am I going to die because they don't know how to wean me off the ventilator? Am I going to die because they didn't even know my medication when I got there. They were asking my husband, well, how much of this is she getting?
Mm.
So
Mm.
circling
Yes.
back to the anxiety, and my husband too, the post-intensive care family, my husband was so terrified to leave me at that place, but they would kick out family after a certain time. And he was terrified. My mom was terrified, thinking, oh gosh, if we leave her here, who's going to advocate for her?
Right.
That was a
Right.
scary time.
Oh my gosh, that would be so scary. That would not instill any confidence if they're asking you and your husband how much medication to give you.
Yeah. Yeah. And
Wow.
how do I feed her? I'm thinking, oh, am I going to die because you guys aren't going to feed me? Am I going to just wither away? I've already lost a lot of weight just by being in bed. I need food to nourish my body to get me strong enough so I can stand up. And they would say, where's your husband? Has he fed you? We don't know how to use that tube. It was a certain kind that. So then again, there comes those feelings of those anxiety feelings of, I'm going to die here. I'm not going to see my child. This is it.
Yeah. Yeah. Oh my gosh, that's so hard. And you shared like the impact that it had on your family too, your mom and your husband. And I'm curious about what it was like when you left the hospital and you got home, what that was like with your daughter, if it was easier for your daughter to engage with you once you were home. Like, what was that like when you finally were able to get home?
The home journey is where the depression finally set in. Hospital setting, it was highly anxious. And I'm not saying when I got home I was not anxious anymore. I still was very anxious, but that's where the depression set in. I walked into my home. I was gone for a total of, oh, maybe 6, 7 weeks or so. And that person that was there 7 weeks ago was a thriving, vibrant, healthy mom, working full time, busy mom that was able to shower herself, eat a meal, drive a car. But coming back home is where the depression set in. I walked through those doors and I thought, I can't drive. I can't get myself in and out of the shower. I can't get myself to the toilet. Can't get myself in and out of bed. I'm completely dependent. So depression, depression, depression. At this point in time, I was not even strong enough to manage my daughter's high energy, so she was with my parents.
Mm-hmm.
She lived with them probably full time for 3 months or so because again the energy, keeping up with her. I was very afraid. I had the tube in my stomach for feeding. I was really afraid that she would want to climb on me and somehow pull that off. So that was a big
Mm.
fear of mine.
Yeah.
But my mom did bring her over a lot. My mom was really great about taking her to preschool at that time and picking her up and
Mm-hmm.
doing all the things with her. And then after school, she'd bring her over for a couple hours. But honestly, I'm gonna get teary eyed again. Um, my mom would bring her over, but I would also feel so bad because I wanted her to stay with me. That was my baby, my child. I wanted her home with me. I wanted to sit around the dinner table with her and have dinner with her. I wanted her to come home and I wanted to play with her. I wanted her to come home. I wanted to be mom. This is something vision I've always had for myself of being a happy, young, vibrant mom that's present with her children. And I couldn't do that. So even though it made me really happy that she was able to come home or see me every so often for a couple hours a day, but it also meant the grief, the sadness, the shame, the guilt
Mm-hmm.
of, okay, now you're here with mom for a couple hours. Now I have to give you back to grandma
Mm.
to take you back. Even though I'm so grateful, my parents were wonderful. They gave me the best life she could possibly have had during that period of time. I wasn't worried about her care with them. I just felt so bad. Every night it was like, okay, here's a couple hours with mom. Now you got to go back.
Mm.
And that just added
Yeah.
depression.
Oh my gosh, yes, the heartbreak of that, of just having to say goodbye every day when you wanted her with you.
Mm-hmm. I
And
wanted
then
to
the
snuggle up with her and take a nap.
oh,
And,
yeah.
and there was a point in time when she finally did come back with us on a more part-time schedule. And in the afternoon, she was still napping at that point in her life, and I would nap with her. And that was just blissful to me. That was just such a special time that we did that together because I needed the rest. She needed the rest. But then as soon as she woke up, I was just, oh, I couldn't drive. I couldn't do all these other things. So it was nice to be able to, hey, mom, can you take her again for the day?
Yeah. Oh, I love that y'all had your little naps to snuggle and sleep together. That's so beautiful. The other thing that I think is any parent listening, especially moms, is going to understand is the shame and the guilt when to somebody listening they'd be like, well, that doesn't make sense, you had nothing to feel ashamed or guilty about. But how much that hangs out with the experience of mothering, and I hate it, right? Like, I don't like it, but it's true and it's there. And I'm curious what you did to like support yourself when you felt that. Like, were you able to remind yourself that it wasn't your fault, or were you stuck there for a bit?
I was stuck there. I won't lie, because that lingered for a long time. Because those thoughts too in my head would keep coming back of how is this going to affect her? I'm
Right.
such a trauma. Even before this, I was so aware of her mental health, just by being a speech
Mm-hmm.
pathologist, because we deal with a lot of kids with traumatic histories and background.
Mm-hmm.
So I was always very aware of making sure her mental health was always being addressed. But now I was like hyper aware of all of these things. So it really, really impacted me that way. Um, even to this day, honestly, I'm still very aware of how is my medical trauma impacting her? Is this something that's going to be living with her for a while? What does she remember? Um, she doesn't really remember a whole lot of it, but there are things like now that she's going through with her own health, which were very, very minor, just things that have happened in the past year and a half or so, that some of those triggers are still coming up with her.
Mm-hmm.
But as far as navigating it with me, I've had to constantly remind myself, Vanessa, you did not do this to yourself. Like, this virus that paralyzed me came out of nowhere. It was,
Mm-hmm.
I just think it was a lot of stress induced. So it came out of nowhere. And I have to constantly remind myself of that, of Vanessa, you didn't do anything to bring this on you. This is just something that happened. You're doing the best you can. Thinking about my inner kids too. I do that a lot, thinking, okay, we are safe. We are loved. I didn't do this on purpose. There's nothing I did to cause this. And maybe my daughter will be stronger because of it.
Yes. Yeah. And I think as a fellow parent, um, trying to always prevent suffering and thinking that we can somehow prevent suffering for our children, and learning that we can't, because they are humans with their own life trajectory, and they're going to go through hard things. And I've shared before that what even brought me into studying medical trauma was one of my children's medical experiences, and the intense guilt and shame I felt, even though, because, well, I made these choices for to take him to get this care, but I was also being told by medical professionals that this is what is necessary to save their life. And so, but again, it's the same thing that you're talking about. These are things that we are making all the best choices we can
Mm-hmm.
in the moment. We are doing the best we can in the moment. And as humans, we're going to experience hard things, and our kids are humans. They are going to experience hard things. And how do we then support ourselves around that? How do we take care of ourselves? I loved your mantras. Will you share those again?
Mm-hmm. Yeah, before I do that, I want to say, just to piggyback off what you were saying, is that our kids are going to experience hardships, and that's just life.
Right. Right.
That is truly just life. Me particularly, I wanted to shelter her from everything that I had experienced. But I realized, I can't shelter her from any of it. But what I can do is maybe give her some tools and strategies
Yes.
to navigate some of those difficult times in her own life. So when she does go through her own hard times, which she will, that's just life. It's just you don't go through a whole lifespan, or even if 50 years, 60 years. Hopefully, she goes to 80 on, but you don't go through that without having some type of hardship, experiencing some kind of family death, some medical issue of some sort. Hopefully, they're all minor, but nothing is catastrophic of what I've gone through. But it's just life, and having those strategies like you always talk about on your podcast of trying to navigate some of the trauma and get yourself into
Mm-hmm.
a more relaxed state is so important as you navigate life all around.
Yes, yes, yes. So much. There is a lot we can do. And the beautiful thing is you, from our conversations, you've opened up like a dialogue with her about it too. So you've normalized the fact that we can talk about it, we can process it, we can be together in it, we can breathe together in it. And so she's getting these tools that both you and I did not learn as children. My kids are getting these tools too because life has challenges. And I do want to go back to your mantras though, because I'm a fan of this, and I'll share one that I use as well. But will you share yours?
Yeah, so mine was, I am safe, I am loved, I'm going to be okay. Safe, I'm loved, I'm going to be okay. And that part of I'm going to be okay is just so important for me because there's so many times that I don't feel like I'm going to be okay. The anxiety creeps in. I think, am I going to be okay? Am I going to live? Am I going to live to tomorrow? Am I going to, your mind starts going, the monkey brain starts flowing in all the wrong ways. And you've got to check those thoughts.
Mm-hmm. Yeah. My mantra is pretty similar to yours, and I believe this is one that I got from Jen Wooten, my teacher. Um, and it is flight is my favorite place to go when I get into sympathetic charge. Flight is kind of my little home when I get triggered. And so the mantra is, I am safe where I am. And obviously, I make sure that's true, right? I do my orienting. I look around the space and I make sure I'm safe. I let my nervous system see that I'm safe. And then I can use that mantra, I am safe where I am. So, for example, in a doctor's office, right? When I start to feel a little triggered after I've done my somatic shaking, um, checked out the space, I'm reminding myself I'm safe where I am. I used this in the dentist chair recently when I wanted to get up and run away.
Yep.
I'm safe where I am.
Feeling safe is so important.
Mm-hmm. Mm-hmm. And it takes time. I want people listening who are like, I don't know what it means to feel safe. You can feel safe, but it takes time, and there are ways to do it. And there are people who maybe spend a lot of their life feeling safe, and they had a medical trauma experience, and now they're like, how do I feel safe again? So Vanessa and I are both here saying we have felt that, and we have also done the hard work to to grow that little bit of safety inside. And it does grow. It's not easy, but it's worth it.
Mm-hmm.
Yeah.
It does take time. Boy, I'm 6 years out and I'm still learning things. I'm still navigating the whole rehabilitation process, the mental games that you go through with it.
Mhm.
and finding strategies that work for me, addressing childhood traumas and things that you
Mhm.
experience as a child, how those play into recovery. There's so many different areas to look at, but like you said, it's so worth it when you start navigating it all and seeing the progress that you can make.
Yes, yes. And I do want to, put in a little plug for the Befriend Your Body community. And that's really this community that I started is really like created to be a space where you can start to slowly find that safety and that relationship with yourself again after trauma, and to do it in community with others who are on that same pathway, right? Because in the first episode that Vanessa and I did together, we talked so much about the importance of community and how community was such a big part of Vanessa's journey to where she is now, her healing journey. So I did want to share for anybody who is interested in trying to find that little piece of safety again, or maybe for the first time, depending on what your story is. There is a community created specifically for that. It's called the Befriend Your Body community. And you can find out more about it on my website, which is medicaltraumasupport.com. Um, Vanessa, I really want the listeners to be able to hear from you how they can find your book, how they can get in contact with you. I would love for you to share that before we wrap up.
Yeah, absolutely. Thank you. But just to say what you were saying about community, I can't see my goosebumps on my arm, but when you talk community, it's a goosebump moment because for me, community and the reaching out to people through or groups like yours were a matter of life or death for me. They really pulled me out of some really dark places. So thank you for making that community for medical trauma survivors. That's huge. So as far as reaching out to me, you can reach me on my website, a new healing, ANEU healing.com. Also on social media as Speechless SLP. So Speechless is my book, which is on Amazon. Speechless: How a Speech Pathologist Lost Her Ability to Speak and Her Silent Struggle to Reclaim Her Life. That's on Amazon. So reach out if you have any questions or need some support in the area of navigating medical trauma.
Yes, and I have to tell you that I did go onto Amazon and looked at your link and read the reviews to your book, and they're wonderful. Like everybody was so moved by your book. And so I wanted to share that with anyone listening.
Yeah, it's
Yeah.
a book of hope. That was the reason I wrote it. I wanted people to be able to read it and gain some hope because I know when I was in my journey myself, I needed that hope that this wasn't my forever and the community that
Yes.
came through. And it's a beautiful story, even though it was very tragic.
Yes. Thank you so much for being here again. I love talking to you. I love hearing your story and like all of like the beautiful pieces that have come in for you, like the care that you've received and your healing pathway. And I was wondering if there's any last little message you want to leave with the viewers and listeners.
I knew you were going to ask that question. And every conversation we have such an in depth conversation. I feel like we cover everything so well, especially the part of community. That's just,
Mhm.
it's huge for anybody going through any medical tragedy, whether you're the caregiver or the actual person
Mhm.
experiencing it or the children. It's important to realize, too, that medical trauma is an adverse childhood experience, an ACE. And these young children need the support and, as you mentioned before, too, the community and and I'm drawing a blank on that word, feel safety and secure. And they need those feelings too, just like we as adults need. So it's important to address all of these little traumas related to medical with children too, because, they say children are resilient, but they also need to have that comfort and reassurance, whether they're coming out of the NICU or ICU or
Mhm.
they're 7, 8, 9, 10, 12. It's all very traumatic.
Yes, yes. And again, like to access that resiliency, they need the care, like you talked about. They need support from loved ones. They need to be able to find safety again in their body. And they do need community because it can feel so isolating. You think you're the only one. and then you join a group, a support group, and you're like, oh, it's not only me, there's nothing wrong with me. This was a hard experience, either a hard experience of seeing my family member ill, or hurt, or an experience in their own body of going through medical procedures, experiences, and to see that it's not just them, they're not alone. That's really the biggest thing, right? Is you're not alone. You may feel alone right now, but find support. It could be through my group, it could be through other groups. I know Vanessa's really involved in the PICS groups and the PICS family groups, and there is a lot of support out there. So again, like if you're looking for support, I'm going to share Vanessa's information in the show notes. You can always reach out to me through medical trauma support. We have resources that we can guide you towards. So please reach out if you're in a place where you really need the support.
Yeah, you're
So
not alone. There's people
yeah,
out there, just like you said, that I always thought I was alone in this journey. I truly did. And then I started to see the light and reach out to community. And then I realized there's people you could step out every day and find somebody else that's right there with you. So, of
absolutely. Thank you so much for being here.
course, thank you.
Yes.